All right, we might get started. Hello, everybody. Welcome, Yapalina. We are very excited to welcome you to today's lunchtime Q&A webinar about the Diploma of Dementia Care here at the University of Tasmania. My name's Dr. Claire Eccleston, and I'm the course coordinator of the Diploma of Dementia Care. First, a little bit of housekeeping. Today's webinar is being recorded, as you will have seen when you entered, and it's going to be uploaded on the website. We also have Lily and Anthony, who are the student administration team, with us here today. Hi, guys. And they'll be answering your questions in the background. And if you could put your questions into the Q&A function, that would be ideal. So first of all, I'm going to have a bit of a talk about the course, and then I'll run through a few commonly asked questions that we hear from time to time. And then we'll answer as many of your questions as we can at the end. And any questions we can't answer during the live Q&A session at the end, we'll respond to by email and after the session, particularly if they relate to your own personal situation. We will be keeping you muted due to the numbers, but please just pop your questions in that Q&A function. Tomorrow morning, you'll receive an email from us, which will have some more of the commonly asked questions that were asked today and answers to those, and also a link to today's webinar so that you can watch it again later if you can't find the website. So the website will also give you at the end as well. I'd like to start with an acknowledgement of country. We acknowledge the Palawa Pakana people of Lutruwita, the traditional owners of the land upon which we live and work. I also acknowledge the traditional owners of the lands upon which you all stand today, wherever you may be in Australia. We pay our respects to elders past, present and emerging as the knowledge holders and sharers. We honour their strong culture and knowledges as vital to the self-determination, well-being and resilience of their communities. We stand for a future that profoundly respects and acknowledges Aboriginal perspectives, culture, language and history. So why would you want to study dementia care? You're probably very well aware that dementia is increasingly prevalent in our community. There's an urgent need to provide quality care in the community, healthcare centres, hospitals and residential care. And it's becoming essential that healthcare workers in aged care develop specialised knowledge in this field. You can see at the bottom of the slide here from the recent Royal Commission that they recognise the sector badly needs increased capacity to deliver quality care. In our dementia courses, we firmly believe that a condition as serious as dementia requires a special type of care and a special type of person to provide it. Our courses will give you specialist knowledge and academic skills, which can translate into numerous work roles and workplaces to make a difference in the lives of people living with dementia and their families. That's something that really motivates us all here at Wicking, making a difference in the lives of people living with dementia and their families and carers. Our courses are not hands-on practical courses, and we do want to emphasise that, but they will rather give you a depth of rich knowledge and understanding that will be invaluable when it comes to providing the best quality care. Our courses are taught by the Wicking Dementia Research and Education Centre. Some of you will be familiar with this already through our online courses, the MOOCs. It's unique in Australia as an integrated dementia centre that's active across a range of disciplines, seeking to improve, as I said, the lives of people with dementia and their carers. It's multidisciplinary, so this means in your course you'll be taught by lecturers from a wide range of disciplines relating to dementia, such as aged care, psychology, neuroscience, allied health, nursing, medicine, and many more disciplines. So you'll be learning about the topic from people who are experts in a particular field and undertaking research into that field. Evidence-based research into the causes, care, and prevention of dementia are integral to our education programs. So you might be asking yourself, what jobs and roles might you go into once you've studied this course? And here it's important to understand the courses aren't like a nursing or an allied health course, which give you a ticket to be a specific healthcare professional. Rather, they aim to give you a breadth of knowledge and expertise that you can apply across a wide variety of roles. So our graduates may find work in a range of career paths within the community and care fields in both the public and the private sectors. Recent graduates have been employed as consultants in dementia care, in general management, policy advice, and in dementia education and training roles in the aged care sector. Graduates can also transition into further study, for example, into a Bachelor of Dementia Care or the Masters of Dementia. If you are coming with a background in healthcare, community service, or allied health, these courses will broaden your knowledge and your scope of practice. So we believe that Diploma of Dementia Care will be of interest for caregivers, aged care, community and health sector workers, and anyone with an interest in learning more about dementia. So what will you learn? This university diploma will help you to develop knowledge on a range of topics that are important when working with people living with dementia. Again, we don't teach direct practical skills, but rather aim to help you grow a deep knowledge and understanding that will help you to provide high quality care and to be an advocate for people living with dementia and their carers. So the course will help you develop knowledge on the structure and function of the brain and the nervous system, how our bodies and brain change during healthy aging, different models of care, services and policies for aged and dementia care, drug and non-drug approaches to therapy, interprofessional practice, behavioural changes associated with dementia, and effective communication for dementia care. Some key points to know about the diploma are there are no tuition fees for study in 2023. You'll have flexible, fully online learning that can be full or part-time options. We'll talk a little bit more about that in a minute. You can start in July 2023, so that's next month. It takes 1 to 3 calendar years to complete. There's no previous study needed. There's a dedicated student support team, including Lily and Anthony here. And there are no exams. So let's run through some questions that we commonly receive about the course. One is, I know that domestic students are eligible for the 100% HECS scholarships. Are there any costs? And the answer to this is yes. Domestic students will pay just a small administrative fee per unit of study. In 2023, these fees are $48.90 per unit, and that's capped at $326 per annum. And when I'm talking about domestic students, this means Australian citizens and permanent residents living in Australia. If you're not sure whether that means you, then please pop your details in the Q&A and we'll email you about your particular circumstances. Or you can contact us later about the details that we'll put up in the last slide. Can I study part-time? Yes, you can study flexibly in that there are full-time or part-time options. Many of our students do study part-time and also work. And this is, of course, helped by the fact the course is fully online. Is the diploma like studying for a MOOC? Many of you probably will have done at least one of our MOOCs, perhaps the Understanding Dementia or the Preventing Dementia MOOCs. And those of you who have tried the MOOCs will find the structure of the diploma is a little different. In the diploma, you'll study for around 10 hours per week per unit across semesters or terms of about 13 weeks long. Material isn't released all at once. We support you to complete each section of content as you go, and that helps you to complete your assessments staggered across those 13 weeks. You will, of course, notice familiar faces from the MOOCs among the diploma lecturers. Just excuse me a second. And the courses, excuse me, do work on the same principles as the MOOC. Just a moment. For example, we do teach you about the biology of dementia, as we know this helps to understand the experiences of people living with dementia and how best to arrange care. We can also, of course, explore the content at a higher and deeper level than the short MOOC courses, as this is a university level diploma. So you get a much richer and more extensive understanding from the diploma, of course. And we also support you to understand the research that is the evidence base for best quality care. I haven't studied for some time. Will there be any help? If you haven't studied for a while, don't be daunted. We have a couple of units specially designed to help you transition into university study that have extra levels of support built in. And they're also the dedicated student advisors that are here today and are answering your questions as we go. What type of people study the Diploma of Dementia Care? So you will find we have a very broad range of people studying with us. Care workers, family carers, nurses, doctors, allied health professionals, people who are here because they just are really interested in learning some more in an online course. We do have quite a number of students who haven't studied past high school or for a long time. So if this is you, you won't be on your own. You'll definitely find there are other students in the same boat. Will there be exams? I've mentioned that there isn't. How will I be assessed if I'm not having exams? So assessments in our course include quite a range of interesting types: discussion board activities, quizzes, oral presentations, written assignments, case study based assessments. We don't have any exams. There aren't any work placements in this course either, but we do try to make our assignments as authentic and meaningful as we can. And they're usually based on case studies adapted from real life work situations. How many units, we've been talking about units a bit, how many units do I need to study in the diploma to graduate? So you would graduate with a Diploma of Dementia Care after successfully completing 8 units of study. How will studying the diploma help me in my work as an aged carer? Possibilities for career progression on the basis of this course really do depend on individual factors. So your previous qualifications, your current working position, your experience in the field, organisational structure, and so on. So we can't give you a one-size-fits-all answer, but we do know that the impact of dementia is increasing, and as it increases, we can reasonably expect that industry change may drive demand for qualifications in dementia and dementia care for a range of roles. So higher quality care organisations, which is all what we're working towards achieving, are likely to need carers with more advanced qualifications. I work full-time and have a busy family life. What level of study should I consider? So students who are new to online learning, are coming back to study after a long time, or are currently in the workforce, are advised to consider part-time enrolment in their first semester. And if you have questions about your own personal situation, it's best to ask our support staff. So you can pop them into the Q&A now or use the contact details we provide in the final slide. We might come back to this slide. I'll sit here and leave this and cover this when we've finished our frequently asked questions, because it'll be good to run through this again at the end when you've done a bit more thinking about the questions. But we have some questions live that I will answer. I will just go to, there's at least one question there that will be great to have Lily to talk to, but how do we do oral presentations? Do we record them or do we do them live online? With oral presentations, you will have in some units, mostly they're recorded, but in some you may do them live online. But don't be intimidated by that. We do build a lot of supports into teaching you how to use the software to prepare a presentation and how to write them, how to speak, all those sorts of things. They're very much supported. So you wouldn't be just thrown in the deep end with no support or structure. Another question I can answer is, will there be tuition fees in 2024? At this stage, this is not determined, so you'll have to watch this space. But if you want to be sure of tuition fee-free study, apart from those small administrative costs, 2023 July, which is semester 2, is your best bet at this stage. And we'll, of course, let people know as soon as we do know about what's happening in 2024. Now it might be best for Lily to answer this question about the O-Week Zoom sessions, because Lily runs those sessions.
Yes, certainly. So I think the question there was, which school do we come under? So our school is the Wicking Dementia Research and Education Centre, and we belong to the College of Health and Medicine. We do have dementia care and ageing studies or Wicking Centre student specific orientation Zoom webinars similar to this one, which we offer in orientation week. We haven't released the schedule for those sessions yet, but we will do very shortly. And once we have those available, we'll send an email to all of our newly commencing students in semester 2 with those dates, so that you can pop them in your calendar. And we also have an online common room unit, which is free in your online learning platform that you access, and we have the Zoom sessions listed in with the links as well. But of course, if you do have any questions about that, or you're not sure how to access them or where to go, you're very welcome to contact us to ask what's going on, and we'll send it through to you.
Yes, the common room unit is a really great source of advice and assistance as you go through. It's always there, and it's got some study skill resources there that you can refer back to during semester, as well as general study advice and announcements that are relevant to your specific semester. And that's a really helpful extra feature that we have at the Wicking Centre. There's a question about how many units are involved. That may have popped in before I mentioned the fact that there are 8 units to study. If you're interested in the course structure, then we can certainly provide that information to you individually, or there are some details online that we could send you as well. How many semesters are there per year is another question. There are 3 semesters a year. Most of the units are available in semester 1 and 2, but we do have a couple of years. We have 1 unit at the moment that's available in what we call the spring school extended semester. It's this funny name for what basically is a summer course of study. So the semester February till the end of May. The second semester is July till the end of October. And then the third summer semester is from November through to February. So at the moment, there's 1 unit available that you could choose to study in that semester. Another question that relates to the structure is, given that the dementia program is nested, are we able to continue on from the diploma to the associate degree and then on to the bachelor degree? If you enrol in the Diploma of Dementia Care, which allows you to get the HECS exemption, then you can easily transfer into the associate degree and continue on into the bachelor degree with no further changes. You could have a bachelor degree to start with, but it doesn't attract that HECS waiver in that first year of study. So we recommend that if you're interested, that you start with a diploma and then transfer into the bachelor degree. Can you start full-time and swap back to part-time within a unit? You can within the course, not within a unit. Once you've enrolled in the unit, you can, of course, withdraw from the unit, and you do get a few weeks at the beginning of each semester until what is called census date to make up your mind, and if it's proving too much, to withdraw. Your best bet is actually to think about your semester ahead, and if you're not sure what the best course of action for you, to contact Lily and the support team and get the advice about what you should enrol in for that semester ahead. But there's certainly flexibility. Probably twice a year is where you're making those decisions about, what am I ready to do next semester? Am I going to be full-time or part-time? And just reiterating, if it's your first semester and you've got lots of other things on your plate, for example, work or a very busy family life, then we do recommend starting with part-time study. Are there structured online classes, for example, via Zoom, that we need to attend as part of each subject? If there are any online classes, we do typically have opportunities to meet all together, which is really nice when we can all make it, but they are recorded. So there's no requirement to attend specific online at this current point, specific online sessions that you'd need to be there for a particular time, because they're all recorded and you can watch them later. And the unit coordinator will typically advise that you pop any questions to them beforehand so that they can talk about them. If you can't be there, you can then get their answers on record. The question, I'd like to start part-time with one subject only, and which is the best subject to start with if you haven't studied for a while? These are all the sorts of things that I believe you discuss in your orientation. Is that right, Lily?
Yes, that's right. We do. The orientation sessions are fairly comprehensive, and we go through all of those kinds of startup questions. And it's a live session like this, so there is also the opportunity for students to ask anything that they're unsure about or that we haven't covered.
And you do, we do send out resources as well, orientation materials that have the course structure there with that sort of advice written in it as well, so you can take it away and think about it. So it'll depend a little bit on your own personal circumstances, but we do have a recommended course structure. There's a question, I've done some units in New South Wales TAFE. Would I be eligible to seek credit transfer? It's probably depending on the units is the answer. TAFE level units for certificate, for example, not necessarily, but it's really dependent very much on what the units are and what level they were. So it's probably best to investigate the credit transfer information on the university website, or to ask the team about your specific units to see what they might translate to. Where do I get a copy of the course structure? Lily, perhaps you could speak to that. The course and unit handbook is possibly the best option that's coming to my mind.
Yeah, certainly. And I think for prospective students who haven't applied yet, that's definitely the best place to look. So on the university's website, you can look up courses in the course and unit site and have a look for the Diploma of Dementia Care or Bachelor of Dementia Care, if that's what you're interested in. And that will show you all of the units that are required for the course that you're interested in. But if you do have further questions about it or how to interpret that information, you can call or email us for further information.
Now, there's a question about the international applicant and how much it costs for us. The information is on the website about the various I believe it's on the website about the international circumstances. It depends a little bit where you are. So it's best to email us specifically, and we can give you some advice if you can't find that. It might be easier just to contact us and we can let you know. The price is usually per unit. If we don't have to attend online classes, how we assess through discussion boards, etc. Well, there's a learning platform you will log into and get all of your learning materials, and the discussion boards are all held in those. Normally what happens with discussion board assessments is you'll participate in the discussion board and then copy and paste those into a Word document and submit it to us to assignments that where they get those tasks will be marked. So all your assessments will typically run through those assignment folders that where the marking occurs and the results and the feedback are released. Occasionally you might have a subject where they're marked directly on the discussion boards, but they're all linked, and the unit coordinator for each unit is able to see those and read them and conduct the assessment that way. If you decide not to proceed after one semester, is there a penalty cost? With a diploma, with any course, you're only charged for the units that you are studying with. So as long as you withdraw from any units you're not going to take in time by the census date, then there wouldn't be a cost. But just remembering in the diploma, the only cost is the small admin fee, but you will have to pay that if you withdraw after that census date. So it's just a question of being on top of what you're enrolled in, and if you intend to withdraw, just making sure that you actually actively withdraw by that census date. Is the study load similar across the units? Yes, it is. We build up in requirements from the early. There are a couple of units we call foundation level units, where we encourage everyone to start when they begin, where the study load will be similar, but the academic writing requirements, for example, or the language that we use is at a more foundation level. So we will support you to develop the skills you need to go on to other units, but it is pretty much similar amount of work. You might find if you're coming back to study after a long time that you are doing a little bit more work in the beginning while you're finding your feet, which is pretty normal for everybody. And then, yeah, then it'll pretty much be the same. Do you get credits for units that you study in the diploma for the bachelor degree? Yes, you do. It's pretty much full credit for the diploma units into the first year of the bachelor degree. So you don't have to study extra units if you're transitioning from the diploma into the bachelor course. Do I need to provide copies of qualifications at application? The instructions for what you need are all on the website, and we can provide those to you. The diploma is an open access course, so you don't need to have studied previously. If you're talking about the bachelor, there are different requirements, so it's just worth checking the university website or getting in touch with us. Question, is there only one unit available in the spring semester, CAD 101, and is there a spring semester each year? There is a spring semester each year. At the moment, that's the unit that is available in the spring semester. Yes, that's the only one available at the moment. Occasionally, we have to change the availability of the units. We try not to move them around as much as possible, but of course, we do have external requirements and that affect the unit availabilities, but at the moment, CAD 101 is the only one available. Will our courses become available on Milo on July the 3rd? The units that you're enrolled in, if you've applied and accepted your offer and you have enrolled in units, they will become available on July the 3rd. Yes, that's right. So that's the orientation week, that July the 3rd week. Would prior learning or experience apply for credit consideration? It depends, I think is the simplest answer for that. It's worth finding out about that, looking at the recognition of prior learning website for UTAS, but again, you can contact us for those details if you can't find that. You should be able to Google recognition of prior learning UTAS, and it'll come up with the page that will help you with that, to find the avenues to explore that. However, it's easier once you've actually applied. But if you want to know the details before you want to apply, then you can email us directly to the numbers that we'll give you. And the last one I would want to pop back to how to apply and accept your offer, given that we've got to 1 o'clock, but I'll just say when applying for all the course, should I include all the pre-tertiary qualifications or the most recent or highest level? I think follow the guidance that's available at eStudent. Did you have anything else? So that's the, I should say that's the application that you will apply in the software, and that comes with guidance. Lily, did you have anything you wanted to say about that process?
The application process.
Mm.
So, I mean, yeah, I think basically what you've described is accurate. It should be fairly straightforward. So as long as you've completed your application and you've got your preferences in the right order, and you've submitted, just keep an eye out on your email in case the assessment team do contact you to clarify anything or would like some additional information from you. But apart from that, it would just be hurry up and wait to receive an outcome. Generally, the assessment turnaround is fairly quick. So within sort of a few weeks, we would expect to see that you'd receive an outcome. And then once you do need to click on the email to go back into the portal to make sure that you've accepted your offer so that we can then translate you into a student.
Yeah, so just to run through that process, you apply directly to the university. Once you're sure that your application's gone through, you wait to get your offer, you accept the offer, and then you wait to receive the orientation package that we were talking about. And that's the email address you'll receive it from. So I think we'll wrap up for now, but do remember that we will respond to you if you haven't had your question answered live. We will be responding to you by email, and I will move to the next slide, which gives you the email address that I've been talking about. So any of the questions that you have still got in your mind or that occur to you in the next few weeks, please email us here, or there's some numbers to call. The ones that are in red will come directly to Lily and Anthony, and also James, who couldn't be here today. So they're the best numbers to use. The others are the central university numbers, which won't be specifically the staff that you've seen here today. So might as well reach us directly. So thank you everybody for coming along today. It's been terrific to be able to have the opportunity to talk to you about our course. And we hope that we will see you all applying and enrolling in our course, and we'll get to talk to you at greater length about dementia.